Hey guys, it's Lauren here from Strong as a Mother, and I have been asked by Sarah from Honeybee Maternity Mamas to come and give some information about cesarean birth, and I feel really passionate about this. My company, Strong as a Mother, enables me to teach women who are going into labor all about how to give birth and how to take ownership of their birth and feel empowered during that process. And I feel like sometimes women that are having planned C-sections or end up having unplanned cesarean sections don't get that same respect. And it's still a miraculous way to give birth. It's an amazing experience. And you still can have a voice if you should need to have a cesarean birth. So today I'm going to be talking about reasons for having a cesarean birth, types of anesthesia used for the procedure, surgical procedure itself, the advantages and risks, how to reduce the risk of needing a cesarean birth, and how to have a more family-centered birth, and some recovery tips. So that's kind of my focus of my mini presentation for today, and I hope it helps. My background is as a labor nurse for almost 10 years. I'm also a certified childbirth educator and certified lactation counselor. You can find all of my classes. I offer individual consultations, a variety of online options such as live and pre-recorded Zoom class options for childbirth, breastfeeding, and baby basics, as well as self-paced, completely online courses for childbirth, breastfeeding, baby care basics, and I even have a breast milk pumping and storing class. So keep that in mind if you're looking for any prenatal education from an evidence-based source that's quality. So reasons for cesarean births fall into a couple of different categories. You might have a planned cesarean birth, an unplanned cesarean birth, or an emergency cesarean birth. So planned C-sections are typically because baby might be in a less than optimal position, such as breech, where they're presenting with their buttocks or their feet, or the baby might be presenting with a shoulder. So the baby's in what's called a transverse lie, or there may be a reason such as mom has a medical condition or baby has a known medical condition where they don't want mom pushing out the baby. An unplanned C-section might happen because your baby is not tolerating labor for a number of hours, or you have stopped making labor progress and cervical change during your labor for a number of hours. Other reasons might include some fetal distress or fetal intolerance of labor, which would be indicated by our fetal monitoring. So those are some of the unplanned reasons. And emergencies are only constituting about 1% of cesarean births, but they fall into categories such as placental abruption, where the placenta starts detaching from the uterine wall prematurely before the baby's born. Might include a cord prolapse, where the umbilical cord prolapses in front of the baby's head and starts to present prior to the baby. Might include a uterine rupture, where the uterus essentially gets a hole in it and the baby would begin to start floating in the abdominal cavity. Very, very rare, but certainly possible, only in about 1% of cases. What are the types of anesthesia used? So if you had an epidural in place already, they could definitely dose up your epidural to find a level of anesthetic that made you very, very comfortable, and they would never cut into you without clamping you on two different sides of your belly to make sure that you were comfortable. They could also do something called a combined spinal epidural procedure, which might be used in labor. Typically, if it is a planned cesarean, they will do a spinal anesthetic. So it's a similar procedure as to the epidural, but it really makes you numb from about the chest level down. There is no lifting those legs up in bed or bending those legs up in bed, but there's no catheter left behind in your back. So the advantages are you don't have anything left behind, as you would during labor with an epidural catheter. And it's a really effective way of getting you super numb from about the chest level down. It's not something they typically use so much in labor because, again, we want you to have some motor function, especially for pushing. And then the third and final anesthetic option would be general anesthesia, where they actually do knock you out. It's the least common method of anesthetic used because we don't want it getting to the baby and having the baby come out slogged. Of course, a neonatologist or pediatrician from the NICU would always attend a cesarean birth. So general anesthetics are not typically used for cesareans unless it's an emergency. The whole surgical procedure itself. So if you have a planned C-section, what should you expect the day of the surgery? So typically a couple of days before the surgery, you will go to the hospital and have some blood drawn. In light of COVID, the hospitals may not all be doing that. They might do your blood work the day of the surgery, but you'll get there about an hour and a half to 2 hours before the surgery to have your blood work drawn, to have an IV placed, to go over your health history with the admitting nurse, the anesthesiologist, and sign some consent forms for the surgery and anesthesia with both your OBGYN and the anesthesiologist. After that, if there's any belly prepping needing to be done down below, the nurse will use some clippers and an antiseptic wipe to help clean the abdomen. We'll also monitor the baby, make sure the baby's in having good heart rate tones and that there's no issues going on there before the surgery. And of course, if your blood hadn't been drawn a few days prior to the actual surgical date, we would draw some blood work just to have your blood type on hand, to check your liver and kidney function, and to check to make sure you're not super anemic. The procedure itself, so when you are going into the operating room, we would always give your birth partner scrubs to change into, have them have their camera ready, and we would bring you into the operating room. We do typically ask your partner to stay outside while the anesthesiologist does the spinal anesthetic. And some tips for getting the spinal anesthetic, if you're feeling super nervous about it, can include just using some slow, deep breaths in and out at a nice slow pace. Do remember your labor nurse will be there holding onto your shoulders, helping you find the right position to get that epidural or spinal anesthetic placed. And we'll try our best to keep you calm. But once that's all done and we put a nice surgical drape on you, then we would have your partner come back in the room for the rest of the procedure, and they'd be by your side till the very end. So what are the advantages and risks of having a planned cesarean? So if it happens to be a planned cesarean birth, an advantage is having known that it's happening on a certain date and time. That can be a bit more relaxing for mom to know that she's going to be having it done on such and such a date. Can help you if you have other children at home and you know you need to plan childcare for them. It's a relatively safe procedure. It doesn't take that long. It typically takes about 45 minutes at max before we get you into the recovery room with us. So those are some of the advantages. Disadvantages to having a cesarean birth include increased risk for pain, increased risk for damage to certain internal organs, potentially, again, very rare complications, something that your OBGYN would discuss with you, but they are a risk. So typically something like an injury to your bladder or your bowel. You can bleed more heavily with a cesarean birth than with a vaginal birth. You are at future risk for needing to have future cesarean births, although VBAC is an option, and a VBAC is a vaginal birth after cesarean section. And you can talk to your provider about what sort of stipulations need to be in place if you were hoping to have a vaginal birth for future pregnancies. It can include things such as a certain number of years between pregnancies, for example. It also includes your provider knowing how the surgery was actually performed and how the scars are on your uterus. So that's important to know. Other risks might include adhesions to other tissues. So again, you can have some scar tissue development, which might impact how your placenta attaches to the uterine wall for future pregnancies. So those are just some of the risks that you have to take into account. You also have more risk of not being as mobile after birth, so there can be a greater risk for blood clots as well, which is why most hospitals today are going to be pushing for early walking quickly after the surgery is completed, to avoid those risks and to avoid pneumonia in your lungs as well. To reduce your cesarean risk. Now, again, some of the reasons that babies go into, for instance, breech positions are not really preventable. And so some of the reasons you might need a C-section you have no control over. But for best advantages, try to, of course, have a healthy weight gain for your BMI in your pregnancy, exercise regularly. If you do go into labor on your own, and it wasn't a planned cesarean, try to stay out of bed as much as possible before getting an epidural. Wait until labor is well established to get an epidural. So try to be more in active labor, so about 6 centimeters dilated or more, or at least contracting every couple of minutes, if at all possible. So try not to get the epidural before you've even had a contraction or two. Try to stay home in early labor, if at all possible. If you're coping well at home, and you're getting through the contractions well with comfort techniques and with the support of your partner and or doula, make sure that you stay home to avoid the chain of interventions that can happen if you get to the hospital sooner than later. And again, use upright, forward-leaning positions. Try to avoid being in the bed unless, of course, you have medication on board that might necessitate you being in bed. So those are some tips to help reduce your risk for C-section. Having a family-centered C-section. So this is kind of new terminology. Again, I think many women felt like they had no control over the cesarean birth experience, and that's not the case. So what are some of the things that you could include on a birth plan for a cesarean birth? And they might include asking your provider if you could have a musical playlist that you play instead of just having silence and sterility in the OR. You could have a little bit of music going on your iPhone, or maybe you could wear some earbuds. Ask if the hospital has a clear drape available. So it would be a blue surgical drape over you during the majority of the surgery, but then when the baby's being born, we would put the blue part of the drape down and you'd have a clear drape in front of you, and you could actually see your baby being lifted out of your belly by the physician. Ask if it's at all possible to do some level of delayed cord blood clamping. So delayed cord blood clamping is often asked for vaginal births to allow some extra blood flow into the baby to help build up their hemoglobin and hematocrit levels, for example. But it's not always something commonly done in C-sections. So ask your provider. Maybe they can even do delayed cord clamping for like 30 seconds, 60 seconds. It might not be as long as with a vaginal birth, but they might be able to accommodate the request to some degree. Ask if you are allowed to do skin-to-skin in the operating room, or if you're unable to due to policy, can your partner take the baby into the recovery room and do skin-to-skin with the baby in there? Ask if you can breastfeed in the operating room as well, if at all possible. And then, of course, ask to take pictures of the birth, and then see if there's any other things that you can modify as per state law and per facility policies. But like, for instance, if you wanted the baby's newborn medications to be delayed until after you were able to breastfeed for about an hour, maybe the hospital can accommodate that. So typically given in the delivery room is a shot of vitamin K in the baby's thigh and an erythromycin antibiotic ointment that goes in baby's eyes. Could ask if it's possible to delay those and give them in the recovery room after you've fed your baby. In terms of breastfeeding and recovery room tips or recovery post C-section, remember this is a major abdominal surgery. This is not something to be taken lightly. You are not going to feel up and ready to go right away. It's going to take some time. So when it comes to nursing your baby, of course, you want to do this as soon as possible after birth if you're planning to breastfeed. So whether it's not in the, if it's not in the operating room, as soon as you can get skin to skin with your baby in the recovery room, please do so to help baby get that good skin bacteria off of you and to start navigating their way to finding the breast for breastfeeding and get that milk, hopefully that wonderful colostrum into the baby within that first hour of life. Positions that might feel better because you've had a cesarean birth include this football hold. So it's like holding the baby underneath your arm like a little football, or it might include you being in a more reclined position with the baby kind of avoiding the lower cesarean section scar just on the upper portion of your abdomen. So you might be in a more biological or reclined back position. Those are two really helpful positions for breastfeeding. Also for recovery, try to ambulate early. So typically within about 8 to 10 hours post-operatively, we would want you out of bed at least to a chair, and certainly by the next morning starting to do some small laps around your room, get up to the bathroom, move around. We want that blood flow going. It'll help reduce your risk of being swollen as well as, again, the blood clots. Make sure you stay on top of your pain management. As hospitals in the United States start to move away from trying to use narcotics as much post-operatively, typically hospitals will, for cesarean births, now have a regimen that includes alternating Tylenol and either an IV drug called Toradol, which is kind of an IV anti-inflammatory, or giving you oral Motrin, also known as Advil, also known as ibuprofen. And so alternating between the two non-narcotic medications may be enough to keep you comfortable for breakthrough pain beyond what's tolerable for you, they do have narcotics available. My suggestion for if you need the narcotics, such as Percocet, for example, is to make sure that you additionally take a stool softener and that you're drinking a lot of water so that you avoid common complications from that, which can include being constipated. So make sure you take a stool softener as prescribed and as should be ordered. Make sure you're ambulating. Make sure you're hydrating really well after the surgery. Now, for the first couple of hours post-delivery, they will probably ask you to stay nothing by mouth to avoid you getting nauseous in the recovery room due to complications of anesthetics. They may also ask that you don't eat solids initially until the next morning after the surgery. So ask those questions to your provider, find out what the hospital's policies are. We just want to make sure that you have bowel sounds and that things are starting to move in the bowels before we start feeding you solids and risk you vomiting and causing more incisional pain and things like that. Obviously, keep your incision nice and clean and dry. Look for any signs of infection that could include any drainage at the incision site, any smell that doesn't smell right, any separation, God forbid, of the incision itself. They normally put these little strips called steri strips on the incision that will keep the scar approximated for about 2 weeks post-operatively. They fall off on their own, but just make sure everything looks like it's in place, nothing's separated. Being mindful getting out of bed, you may want to brace your abdomen with a pillow or something else for support when you're getting out of bed. Certainly, also be very careful standing up. Make sure you use good posture. Try to hold your abdominal muscles in as much as possible. Find out if the hospital can provide you with an abdominal binder to help keep everything in place, or ask your provider if they would recommend one that you would get from like Amazon, for example. So ask if they recommend those abdominal binders. Many do, especially a lot of pelvic floor therapists also recommend them for having a cesarean birth. So find out if it's recommended. That's not my specialty area, but it's something I do recommend looking into. And then finally, just remember that having a cesarean birth can make you feel like it was a bit more of a traumatic experience, or it can feel a little bit more emotional because you didn't have perhaps the vaginal delivery that you anticipated having. And it can be challenging to come to terms with that. So make sure that you have support via a mental health specialist, like a therapist, for example, or a postpartum support group. My company, Strong as a Mother, happens to offer a free bi-weekly support group via Zoom for pregnant and postpartum women. So if you have any concerns or complaints, or you just want to process your birth experience in a small group setting, you're welcome to come to the group and talk about it. And if not, and you'd want to do that privately, certainly find a mental health therapist that takes your insurance and can work with you about how to process your birth so that you don't come out of this experience feeling traumatized or that it was a negative birth experience. I want you to have a wonderful cesarean birth, whether it's planned, unplanned, or God forbid, emergent. And I want you to feel like you do have some choice in this. It's not all set in stone. There's things that can be flexible, especially if it's a planned cesarean. So those are my biggest tips for today. I hope that this little lecture was helpful in some way. I know I was kind of all over the place. If you have any questions for me, please reach out. I can be found on Facebook and Instagram at Strong as a Mother CT. I have a free mamas group of my own on my Facebook page called Strong as a Mother Mamas that you're welcome to join in. And my website is www.strongasamother.net. And again, I offer a variety of prenatal classes and private consultations. I'd love to work with you more and make you feel like you can have this empowered birth experience of your dreams. If I don't speak to you, have a wonderful day, and thank you for joining me today.